Hello everyone, my name is Catherine de Figueiredo and this presentation is on acute stress disorder. In this presentation, you will be learning about acute stress disorder, also known as ASD, a disorder in which many individuals develop after suffering or seeing a traumatic event. Throughout this presentation, we will cover the following information: description of ASD, the etiology of ASD, common or comorbid disorders of ASD, effective treatment of ASD, an additional reference article for your review and further knowledge of ASD, as well as a personal reflection of what I have learned during this process, as well as what I hope you all were able to learn from this study. Description of acute stress disorder, ASD. Acute stress disorder predicts the development of post-traumatic stress disorder, PTSD, which in some sufferers can persist for years and lead to significant disability. Acute stress disorder, ASD, develops when an individual experiences a traumatic event, whether it is directly to the individual or an individual seeing a traumatic event. Etiology of acute stress disorder. Factors increasing the risk of ASD and PTSD in someone suffering a sufficient precipitating event include the following: loss of a loved one in the event, significant injury from the event, witnessing of horrendous images, dissociation at the time of the traumatic event, development of serious depressive symptoms within 1 week that last for a month or longer, numbness, depersonalization, a sense of reliving the trauma, and motor restlessness after the event. Pre-existing psychiatric problems, previous trauma, loss of home or community, extended exposure to danger, toxic exposure, absent social support, or social supports who were also traumatized and thus are incapable of adequate emotional availability. Common comorbid disorders. The common comorbid disorders associated with acute stress disorder are depression, anxiety, alcohol abuse, drug abuse, and panic disorders. Acute stress disorder often leads to post-traumatic stress disorder if not diagnosed and treated correctly. Acute stress disorder, ASD, was introduced into the DSM-IV to improve research and identify individuals who are at high risk to develop a post-traumatic stress disorder after a traumatic event. In DSM-IV, ASD was classified as an anxiety disorder which is diagnosed in traumatized individuals who suffer from at least 3 dissociative and 1 intrusive symptoms, as well as marked avoidance and arousal symptoms within 2 days and 1 month after the experience of a traumatic event. Since the introduction of DSM-5, ASD is classified as part of the new section, Trauma and Stressors-Related Disorders, and has been defined as a disorder that emerges within 3 days to 1 month after the exposure to a traumatic event. It is characterized by 9 or more of 14 symptoms out of the following categories: intrusion symptoms related to the event, avoidance of trauma-related cues, increased arousal, mood deterioration, and dissociative symptoms. The symptoms persist for more than a month in a subgroup of trauma victims who are given the diagnosis of PTSD. Effective treatments. The most effective treatment in combating acute stress disorder thus far is cognitive behavioral therapy, CBT. This form of therapy has 2 main components. The first is that it aims to change the patterns and cognitions of the thoughts around the traumatic event. The second being that it attempts to alter the anxiety in provoking situations. Other alternative forms of treatment are psychological debriefing, anxiety management, and psychotropic medications. All of these treatments can work in their own way, but as stated above, CBT has been the most successful. In the next slide, you will view an empirical slide showing results of CBT treatment. Although I know that this film is not very clear and is hard to read, please take a moment to view the psychological treatments evaluated in randomized controlled trials by trauma type. This film covers post-traumatic stress disorder as well as acute stress disorder. It has categories such as assault, childhood abuse, partner abuse, mixed assault, combat veterans, natural disaster, police officers, refugees, road traffic accidents. Just take a moment and review it, and you will see the results of CBT and psychological trauma. Now that we have taken a moment to review that film of empirical study of CBT therapy for acute stress disorder, please take some time to review this article as it contains a great amount of informative information on ASD. I chose not to post the whole article, instead post the link where you could actually go and look at this article, which is called Practice Guidelines for the Treatment of Patients with Acute Stress Disorder and Post-Traumatic Stress Disorder. I wanted to be able to have this for future reference. I found it very informative and really brought a lot of insight to my knowledge of ASD. So take a moment and review it. Reflection. As I started to research in detail about ASD, I found myself feeling very naive and undereducated in regards to what I might have thought I already knew about ASD from my medical background. ASD is such a serious and critical disorder that needs to be taken very seriously when an individual shows signs or symptoms of having ASD. For this could mean the difference of treating ASD and helping one cope with the traumatic event that has caused ASD to trigger versus treating an individual with PTSD from ASD. Although there are certain guidelines of traumatic events that can cause ASD, this does not mean it is the same for everyone. It is very important to take in consideration all internal and external factors in an individual's life, may it be past or present circumstances. I hope the information I have shared with you will give you a greater understanding about ASD and all the important factors to consider when assessing and treating individuals with ASD. Thank you very much for reviewing this presentation, and I hope you all have a wonderful day.